At the time we found out he had sickle cell, I had just lost my cousin 2 years prior to sickle cell.
I'm in a hospital because I having a pain crisis. I got sickle cell.
I was diagnosed with sickle cell disease at the age of 1. I had been to the hospital 200 or more times.
Every time he get fever, we have to go to the emergency room. We'll stay about 2-3 days tops because they have to get him fluids and pain management. So we have to go to the hospital like whenever we see swelling or his hands or his feet, or if he just got a certain cry and we feel like he's in pain. Because at the time he was 1, so he really couldn't say, I'm hurting. It's hard as a parent to see your child in pain for hours crying and you know there's nothing you can do about it.
Sickle cell disease is an inherited blood disorder of the red blood cell. And in sickle cell disease, the information that leads to the structure of the hemoglobin is different so that the cell can have a shape that is turned into a sickle, which is like a sharp knife.
It causes you to have bone pain, joint pain, chest pain, headaches. You have to have many surgeries and transfusion and spend a lot of times in the hospital.
They told me that he was gonna have pain. Their immune system so low, so any little thing that somebody have, they prone to get it. That he couldn't be in the pool too long or be wet too long or too much stress. He had to stay on a healthy diet to maintain his pain level.
We have not only the largest pediatric hematology program in the country, but we have the largest sickle cell treatment program in the country. We care for more than 2,000 patients who have sickle cell disease. We have some of the latest in clinical trials that we offer here, as well as some very unique curative therapies that only can be offered at high volume centers and specialized centers such as the Aflac Cancer and Blood Disorder Center.
We work with the families very closely to help them be aware of when the children are ill, and because if we can act quickly, we can often change the course of things that might be life-threatening.
We learn how to do self-pain management instead of going to the hospital all the time.
You have to manage yourself, like drink water, eat fruits and stuff, and just try to stay healthy.
I love children. I love my Hugh Spalding team, the whole 3rd floor. When he's their child too. If I'm upset, depending on the hospital visit, it's always somebody there that's gonna talk to me and calm me down and, let me know it's not my fault or it's okay to feel the way I'm feeling at that time. So children has been a blessing to my family. As sickle cell parents, we don't know when they're going in for a crisis, would they be the last time they're going in or would they be coming home with us? They go to 0 to 100 real quick. He can just be in there for a pain crisis, but then his liver can fail. So it's just hard not knowing. It's the not knowing what's the outcome gonna be when you go to the hospitals. He's a miracle because what Dontavius have been through in the 13 years of his life, some grown people could never go through and still be as strong and willful as Dontavius. You never see him too much down or crying or complaining, oh, I can't because of I got sickle cell. Dontavius the type, he's gonna push. He's gonna push until he can't push no more.
If you would pray for me, that will be good. But we'll be in the hospital every month. So if you would pray for me, that's all I want.